Hello, and hi, everybody. My name is Moraine, and I'm one of the LASIK coordinators here at Stahl Vision. And today I'm sitting down with Dr. Brian Stahl, Dayton's leader expert in LASIK surgery. And today we're going to talk about all things LASIK and answer some good questions for you. So are you ready to jump into it?
I am, Moraine.
Perfect.
Thanks for being here tonight.
All right. So first, let's talk about what LASIK surgery is and then what it's designed to do.
Yeah, there's some synonyms. There's LASIK surgery and PRK and laser vision correction and laser eye surgery. They're all basically a different way to help people see a little bit better. So with the different types of lasers, we can remodel the shape of the eye. So for instance, if you're doing LASIK surgery, first step, you create a thin flap of the surface cells, and we laser remodel under that in order to fix nearsightedness, farsightedness, or astigmatism. And we put those surface cells right back. And it's a fairly fast recovery because you've saved those surface cells. So that's what LASIK surgery is.
Awesome. Well, let's talk about some of the benefits of having LASIK versus staying in glasses and contacts.
Yeah, some people are doing well with their glasses and contacts, but not everybody, especially with contacts. Sometimes long work days, you're on a computer, your eyes are drying out, your contacts are sticking, they get all fogged, you're not seeing very well. Some people have infections from contacts or just develop allergies to them where they can't wear contacts. And, glasses are okay, but, as we experienced when we're all wearing masks a year or so ago, every time you get that mask on, it fogs up your glasses. Same thing happens in the winter. When you walk in a warm building, what's the first thing that happens? Your glasses fog up and it's hard to see. Or if you're out in the rain, you're rain speckled. So glasses and contacts are okay, but sometimes there's some better options for certain people.
Really awesome. And then a lot of people have heard that having astigmatism will knock you out of being a candidate for LASIK. Is that something that's true?
It's actually the most common myth that we hear. And we'll have patients say, oh, I can't have LASIK because I have astigmatism. Or my eye doctor said I can't have LASIK because I have astigmatism. It's actually kind of the other way around. People with a lot of astigmatism, they're very hard to fit with contact lenses, and sometimes they can't wear them. And glasses do work, but they only work dead straight ahead. If you start looking to the side through your glasses, all of a sudden the image isn't as good. So some of these people don't have a lot of good other options. Glasses and contacts aren't working very well for them. So a lot of the patients that I see do have even large amounts of astigmatism, and they're getting laser vision correction because the other options aren't working for them.
Yeah, and I definitely had a decent amount of astigmatism before my surgery, so I can definitely account for that as well.
So tell them a little bit that you had surgery even before you were my patient.
Yes, I did. Yep, and I got a job because of it. So I love surgery. Love surgery.
Oh, that's fantastic.
Let's talk about a little bit about night driving, because I know that was an issue for me before surgery. So what about after surgery? I know that that's a misconception that a lot of people do talk about.
Yeah, the older generations of lasers, 25 years ago, some people had some night glare and their night vision wasn't quite as sharp. With the newer generation of lasers that we're using now, most people notice actually an improvement in their night vision. As a matter of fact, with the laser we have now, you're about 9 times more likely to have an improvement in your night vision instead of a worsening in your night vision. So a lot of our patients are saying they see better. Now, most people will see a little bit of haloing and rings around lights like you get with a soft contact lens, but it's usually not very objectionable.
And now some of our patients do have a few more birthdays than others, and they're having to worry about the bifocals and then the dreaded sticking your arm all the way out trying to see things. So what can LASIK do for those patients?
Yeah, if you're fortunate enough to live past 40 years old, that's me, you're starting to notice it's a little hard to see up close. You start pushing things further and further away. And then eventually you get tired of doing that and you get a pair of reading glasses or you wear bifocals, or sometimes people will do monovision, which is one eye near, one eye far. And you can do that with contacts. Well, you can also do that with LASIK surgery. Now, it's a compromise. It's hybrid vision. You've got some distance vision, some near vision. That's not for everybody. For instance, if you're a truck driver and you drive overnight hauls, well, you need the best possible driving vision. So you're probably going to want both eyes set for distance. And, if you're an engineer or an accountant, you're doing really fine, detailed up close work, well, monovision may not be good enough up close vision. So you're probably better off with dedicated reading glasses. But some people will have a mixture of tasks, near and far, and they may do very well with monovision.
Well, let's talk about contacts for a second. So we do get a lot of phone calls, and we do have our patients remove their contacts prior to the exam. So will you talk about why that's important?
Yeah, when you come in for your exam, we measure your eyes, and we're going to do that treatment for the rest of your life, right? So we want the most accurate measurements. And sometimes contacts can cause some molding or changes in the shape of the eyes,
Mhm.
and that can kind of mess up our measurements. So we want you out of your contacts for about 7 days if you're in soft contacts, 14 days if you're in hard contacts, and let your eyes breathe and gets the shape back to a normal, healthy shape. So we want the most accurate measurements for your surgery.
And what about patients that have dry eyes, or if they don't even know that they have dry eyes?
Dryness is a very common problem with or without contacts or LASIK or anything else. And when you come in for your exam, we actually measure people for dryness.
Mhm.
Most people will notice their eyes are drier than they're used to for about 3 months after their LASIK surgery. It does go back to a baseline. Now, sometimes baseline's a little bit dry. As a matter of fact, some of our patients come to see us. The reason they're coming to see us is their eyes are getting drier and they can't wear contacts
Mhm.
any longer, right? So there's some things that people can do, and you can start that even now. You can take flaxseed oil by mouth or fish oil. It's a capsule you take by mouth, and you can use non-preserved artificial tears, and then clean your lashes and get some of that crust and sleep off of your eyes. And doing those three simple things, a lot of times the dryness is a lot better.
Awesome. Well, like we discussed earlier, I had my LASIK done here before I even worked here. So I was very confident in the practice. But for our future patients, will you tell them why they should be confident in our practice?
Yeah, there's some choices and who you might choose to get laser vision correction. And the reasons that we're Dayton's most popular choice for
Mhm.
eye doctors and for patients alike, usually they come to see us. And so if you think about the different factors, one of those factors is the technology, right?
Mhm.
The laser we have is the best laser that's in the Miami Valley. It's the only one of its kind here.
Wow.
And really awesome things we can do that laser technology. We talked about the night vision and the improvements we're seeing in night vision. It's some about the surgeon. I've been doing this a while now. I'm getting a little older. Been doing this 25 years. I did the very first patient in the Miami Valley. I've done the most in the Miami Valley. A lot of people want an experienced surgeon. And then last, it's the accuracy or the results that you're going to get, because that's what you're going to live with the rest of your life. We're very fortunate. We've done this 32,000 times. We have a huge database of these patients and how they've turned out. And we can use that to create something called a nomogram. Nomogram's fancy word for a formula, and basically use all that prior experience, all those prior patients, to predict what you need to do to have the very best possible vision with that. Doing that, we have a very low enhancement rate. Very few people need touch-ups, and it's just more accurate. People are seeing after better.
Awesome. And then let's jump into a few questions that we do get about LASIK all the time.
Yeah.
All right. So do we give the patients any type of sedation or anxiety for their nerves prior to surgery?
Yeah, I guess I'd only really be worried about somebody if they weren't kind of anxious or nervous when they came in. So, there's a couple things that help. One, when you have your procedure, you're going to have one of our staff members walk you through the entire procedure from start to finish. They're going to hold your hand during the surgery. They're going to go over everything that to expect ahead of time. They're going to go over the aftercare afterwards. And doing those things, it helps for people to feel a little more comfortable. But the other thing is we're going to give you a Valium. It's amazing how courageous people can be with a Valium. That Valium makes it so you don't feel like your heart's pounding, you're not extra anxious.
Okay.
So most of the people get through the procedure and find it's not as scary as they thought it was going to be.
Awesome. All right. Another question. Will they be able to see things coming at their eyes when they move?
There really isn't a lot coming at you. The microkeratome, when it creates that flap, your vision kind of goes dark for about 5 seconds. You feel a little vibration. And during your surgery, you're going to be looking at a green blinking light, but it's not very anxiety provoking because there's not a lot of things coming at you. For instance, I have a lot of people that say, I can never even get a contact in my eye. And those people are having LASIK surgery. So it doesn't seem to be much of a problem.
And then does the surgery hurt at all?
Yeah, it's amazing. With the numbing drops that we use, people are very comfortable for the surgery. They don't feel very much. With the microkeratome, you feel a little bit of a pressure sensation. Have you squeeze your hand holder's eye for that particular point, or hand for that particular point. But yeah, there's no real pain associated with the procedure.
That's great. That's great. And would you say that the procedure is safe?
We've been doing this 25 years, and in the United States, there's been about 2 million procedures done. And, one of the questions I get is they're even more blunt than that. They say, can I go blind from this, doctor? And the answer is, we've never had anybody have serious problems like that. Nobody in the United States has ever gone blind. Now, you can never say never, but it's very low. Now, a good question is, what complications do you see? And I usually like to go over, what's the worst that can probably happen to me and what's the most common? The worst is probably an infection, especially if you got an infection in both eyes. We work very hard to prevent that. Turns out it's easier to prevent a complication than to handle it afterwards. So we put you on antibiotics starting the day before surgery, keep you on those antibiotics for a week after, and we have you clean your eyelashes. A lot of times there's some bacteria and stuff on your lashes, so we want to get that all cleaned off. It turns out you're actually more likely to have an infection from wearing contacts. A lot of our patients have come in because they've had contact lens related infections, and they're getting out of their contacts and they're coming in and having to, doing this. Now, we've done this about 32,000 times, and we've never had one of our patients get an infection. We don't ever want anybody
Proud
to.
of that.
What's more common things that we do see? We talked about dryness. Most people do have some dryness. Your eyes will be drier for about 3 months after your surgery. We like to pre-treat that. We actually measure people on their exam to see how dry their eyes are, and we can kind of predict how much problems they might have with that. But that's 100%. Everybody has drier than usual eyes for about 3 months. And in most of the trials and most of the studies, we find your eye function goes back to about normal after 3 months.
And then will you tell me a little bit about the restrictions after surgery?
Yeah, after you have your surgery, we don't want you to go home and take a nap. Most people say it feels a little bit like you've slept in a contact lens. It's a little scratchy. You're going to go home and take your nap. Don't want you working or driving the next day, but most people could drive maybe late the day afterwards and maybe work the weekend after that.
Wow.
There are some restrictions on exercise. I don't want you in a hot tub. I don't want you going down a water slide. I don't want you exercising for a week or so. And we'll give you a list of those. But most people are back doing most activities and back to work and driving within a day.
And a lot of patients do call in asking questions about the cost of surgery and if insurance would cover that. So can you go into that a little bit?
Yeah, insurance doesn't cover the cost. It's an elective procedure, but some people have an insurance plan that offers a discount on LASIK, and we certainly honor that discount. It's actually more affordable than you might think. If you add it all up, it's actually less than the cost of a cup of Starbucks coffee, which anymore is not that cheap, but still, it's less than the cost of coffee per day. And if you added up the cost of contacts and cases and solutions, you actually end up saving money over a period of time. Our center, we charge $24.90 per eye to have the surgery done. We've got some good finance plans, and
you guys will get $1,100 off today for joining this seminar.
Yeah,
so we appreciate you guys joining in.
Yeah, that's great that they can save that amount of money. And I know there's some ways that people can make that even more affordable. And you're our coordinator. Can you tell us a little bit about what people can do to make it more affordable?
Yeah, and we will talk about all the finance options when you do come in for the day of your consultation, but we do accept Visa and MasterCard. So if you're wanting to get those points, make sure you pay that way. And then we finance through a company called Care Credit, which a lot of other offices do use, but unlike other offices, we offer 24 months deferred interest. So you won't need to make a down payment the day of surgery. And 24 months deferred interest afterwards. So
now, if somebody has like an HSA or an FSA, one of those government healthcare plans, can they use those too?
Absolutely. And then we do offer 3% off for cash or a cashier's check. So if you have that refund check burning a hole in your pocket, make sure that you bring it in.
So tell me about the 24 months deferred interest thing. How's that work for somebody? If they come in and they do that, what's that mean?
Yeah, so the day of surgery, we would apply the full amount to Care Credit. And then from there on out, you would just take your payments through them.
And they have to make regular payments as they go along?
Yep, monthly payments.
Oh, that's awesome. And now we defer the interest for them, so they don't have any interest for 2
24
years?
months, yep.
That's a pretty good deal for people, I think.
Yeah, and again, we'll go over all of this at your exam, so don't worry too much about trying to memorize anything. Awesome. But we do have some questions coming in from our viewers, so if you'd like to jump to those. All right, so this one is from Ben. What are some common types of eye conditions that would keep someone from being a good candidate for LASIK?
If you're going to have LASIK, you need to have fairly healthy eyes. So certainly if you have glaucoma or cataracts or macular degeneration, you're probably not the best candidate for LASIK surgery. When we bring people in, we measure their eyes, we look very closely to see if there's any problems, contraindications during the surgery. The most common things that I see is if somebody has some lens changes, maybe early cataracts are developing and their eyes are changing. And then some people have a thin cornea or an irregularly shaped cornea. And those are people that you don't want to do surgery on because that can make that actually a little bit worse. So when we disqualify people, it's usually those two things.
All right. And then here's a great one from Jenny. Is there an age limit?
There are some practical age limits. You certainly need to be 18 years old, and you want your prescription stable. So if you're very young and prescription's getting much worse year over year, you want to wait till your prescription's stable.
Mhm.
On the top end, as we all live long enough, our lens starts to change. We get some lens changes. Eventually, that'll turn into a cataract. But by age 55, some people are getting some lens changes. And if those lens changes are causing a prescription change, then LASIK's maybe not a good idea. So somewhere between 18 and 55 is an ideal age to get this done.
And would LASIK prevent cataracts?
LASIK doesn't stop you from getting cataracts. As we all get older, we're still going to get cataracts, need cataract surgery, but it doesn't cause them either. So again, getting it done younger is only a benefit because you've got more years to enjoy your vision without your glasses and contacts.
Absolutely. And then Ben also asked, the thing that is keeping me from actually going in for the consultation, is the process truly a pain-free during the procedure?
Yeah, there's no pain during the procedure. There is a suction ring that we use to create the flap, and you'll feel some pressure during that. We'll
That's
have
what I
you hold your hand holder, and you went through
Yes.
this. I don't think it's too bad during the process. So people are surprised. Afterwards, most people compare it to like, oh, I slept in my contact lenses.
Yes.
And that's why we do want our patients to go home and get their nap. And when they get their nap, then they're feeling a little bit better afterwards.
Yes,
So.
absolutely. And then this last one will be from Debbie. It is probably my favorite. Will my sight change immediately after LASIK?
Yeah, that's the fun part of being a LASIK surgeon, right? I get people their vision back. So we did LASIK surgery today. I had a couple of people that just sat up and I said, hey, can you see the clock across the room? And I got this big smile, and sometimes they get big crocodile tears and they say, I can see, and you probably experienced this when you had yours.
Yes, I definitely almost cried. I was right there.
I love it.
Yes.
People their vision back, they sit up, they can see. Now it's a little foggy, a little blurry. Yeah, there's some swelling, and it's going to be a little better after their nap and better the next morning. But most people are shocked, especially the people who are blind. They sit up the next day and they can see.
Absolutely.
So
yeah. And then that's all the questions that I have for you.
All right. We might have some other questions. Lincoln, did you have another question that they were asking?
I do have a couple.
Sure.
So one of them is, do you see retreatment needed often?
That's a really good question. The question was, do some people have to have the treatment done more than once? We look really hard at our numbers. For the average nearsighted patient, 98% of them are 20/20 with a single treatment. Now let's flip that around the other way. That means 2%, 1 in 50 people might need an additional treatment. Enhancements, retreatments, and second treatments, however you want to phrase it, those are free the first year if you need to. Our enhancement rate is very, very low. When we look nationwide, ours is much a fraction of other people. And that's because we work very hard on the front end to get the most accurate results for people going in. So some people do need enhancement free the first year, greatly reduce costs the rest of your life. Great question.
Any other questions?
How do we know that the eyes have stabilized by 18?
Oh, there's another question.
Yeah.
The question was, how do I know my prescription's stable? There actually are standards for that, less than half diopter change over 2 years' time. So usually what we'll do is we'll try and have you bring in some of your old glasses or contacts or some old prescriptions, and we'll measure and we'll look. And again, if your eyes are changing real rapidly, we'll say, hey, it's probably a good idea to wait a little longer. For men, usually by 21, 24, your eyes are stable, all right? I don't know that men ever grow up, but that's when their eyes stabilize, right? For women, it's usually a little less. By 18 or 19, your prescription's fairly stable. Now, there's exceptions. For instance, if you want to be a federal marshal, an FBI agent, state highway patrol officer, and certain military occupations, you have to have better than 20/40 uncorrected vision. In other words, you have to be able to get rid of those glasses and contacts. So sometimes we'll see somebody and they're 19 years old and we'll do the surgery and say, listen, get through academy, get through the next 5 or 4 years, and then come back and see me. And if it changes, we'll go back and do a touch-up then. So there are certain people with occupations that require good uncorrected vision without glasses and contacts, and we'll do them even at a young age. But when you come in, we'll measure you and we'll decide together if you're stable or not. So, okay.
Are there prescriptions that are too severe for LASIK?
Oh, there's another good question. So the question was, are there prescriptions that are just out of range, too much? Well, fortunately, with the laser technology that we have here, there aren't very many people. There are some. I would estimate about 1 person in 1,000 is outside that range. So if you happen to know, if you are more than 12 diopters nearsighted, which is a lot, do you remember how nearsighted you were, Maureen?
I was about a -6.
Okay, she
or
was a
so.
lot.
Yes.
All right.
It was
Can you
pretty
imagine
high.
being
Yeah.
twice as nearsighted
I
as
took
you
off my
were?
glasses and I could see colors and shapes, and that
That's
was about
about
it.
Or if you're farsighted to about a +6. And then we talked about astigmatism. It turns out we can correct huge amounts of astigmatism, up to
Mhm.
6 to 8 diopters of
Wow.
astigmatism. Almost nobody has that amount of
Yeah, that's
astigmatism.
incredible.
Correct. So the range is really, really
Mhm.
wide. And there are some other alternatives for people who are past that range too. So don't let that make you think, oh, I can't have it done. You need to come in for your exam. And by the way, how much is eye exams if they're thinking about LASIK surgery?
So it is a free LASIK
Oh,
consultation.
it's free. So there's no reason not to come in and
Absolutely.
figure it out. Okay.
Yes.
Fair enough. All right.
And one last one that we'll go ahead and go over. And that one is, can I wear contacts again after the exam prior to the surgery?
Yeah, this is our last question. And the question was, okay, so I have to be out of my contacts. I hate my glasses. I want to minimum,
Mhm.
but I want to come in, I wait the exam, kind of go back to my contacts. And the answer is maybe. Depends on when you have your surgery. A lot of times people will be out of their contacts, they get their exam, and they'll schedule their surgery. And the surgery will be within a week or two, and they just stay out. But every now and then somebody say, no, I don't want to do my LASIK till the summer or something like that. We'll say, well, sure, get back into your contact lenses and we'll still get you out of them a week or 2 weeks ahead of time. And then you can go back to your contacts until it's time to have your surgery. So yeah, you can go back to the contact lens wear. So those are great questions, by
Those
the
are
way.
great questions. And then what would you say that patients say after they come out of surgery? What would you think their statement would be?
Well, you're my refractive coordinator. Tell me, what do
I
they
can tell you that,
say?
absolutely. So patients always wish that they got it done sooner and that it was not nearly as bad as they thought that it would be. It's just an incredible
Yeah.
experience, definitely.
That's what I know. When I see people set up, they go, that's it. I
All
just
right.
was more scared.
We
than
gotta have
this."
our
I go,
easy button for
okay.
that.
Yes, you do.
I
So,
love it.
oh, that's awesome. So, well, so Maureen, let's say somebody's ready to do this. What do they do next? What's the next step for people?
So you can definitely just visit our website at stahlvision.com to schedule that free LASIK consultation, or you can give us a call at 937-643-2020 and we can get that scheduled for you.
That's awesome.
Yeah.
And you know, our website has excellent information. So if you didn't get your
Absolutely.
questions answered, I know we can't answer them all. Our website has a lot of technical information. So that's another good place for them to get information. So,
Yeah. And then we hope to see you all in the office soon.
yeah, looking forward to meeting
Looking forward to
everybody. I
seeing you
appreciate
guys.
everybody coming to our online seminar.